from a really young age, like 14, 15, you start seeing it in magazines, all the celebs, they're getting their lips done, they're getting this done, they're getting that done. You instantly want to change yourself.
The industry is very unregulated, and basically anyone can inject dermal filler regardless of qualifications.
You have to act in a professional manner, a certain way, and be confident in what you're doing so that you're safe, and be competent in it.
And that's the thing, I think, is competency.
Competent, yeah.
Because me and Kim have never offered certain types of filler, for example glabella filler or nose filler, because we don't feel competent enough to do that, because that's such a high risk treatment. If anyone wanted it doing, we would then turn around and say go see an aesthetic surgeon. We know that up to a certain level we are safe, but then beyond that level we're not. And I think the problem is there are some non-medics in the industry who will carry out even the high risk treatments, but they don't understand the consequences.
I can't remember what it was that she put in my lip. They just went really lumpy. I literally had to go back a week later and I had all these ripples in my lips, like all these hard lumps. So she had to squeeze all the lumps, prick them and squeeze the filler out, which left like loads of just dents in my lips. They looked dreadful.
Dermal fillers don't come risk-free, so it's mainly knowing how to manage them.
Hyaluronic acid is already in the body, but lidocaine is mixed in with it, and people can have allergic reactions to lidocaine. So you've got to have an EpiPen on site and be trained to use the EpiPen.
Be happy managing an airway that was
If someone's
not
airway
okay.
collapses because they can't breathe because they've had an allergic reaction, it's managing that. I had someone once who had a vasovagal fit on my table, and I had to manage that quite quickly. You can also get things that don't happen straight away. So you can get your vascular occlusions, which is where the filler's put into a vessel and it cuts the blood supply off, which later on the tissue starts to die inside the lip. That can go on to sometimes need steroids, antibiotics, and at its worst hyperbaric chamber treatment and plastic surgery referral if the skin falls off the face. Vascular compression, so that's where there's almost too much in the lip, so it constricts the vessels, so you almost can get the same effect from an occlusion but through compressing the vessel.
So it starves the tissue with oxygen because the blood can't get to it.
And recently we've seen an increase in delayed onset inflammation, so 6 months later they are
get cold virus, and the body looks to find the virus and kill it, but it finds the filler, and because it's not natural, it then attacks it, so it can become infected and inflamed. So if you can recognise those things, you can then treat them quite quickly, and that's when the problems come, because if you don't recognise it very quickly and act on it, then that's how it escalates. Ends up being quite a serious event.
Such a massive thing, you're injecting someone's face. You need to be trained as trained can be. You wouldn't go and get your bloods taken by someone who isn't medically trained in it.
Most of the training that isn't for a medic, your requirements are some first aid and some background learning, and that's it. It's not really as comprehensive as what we've done for a 3-year degree and then a nursing career in acute settings and seeing anaphylaxis and dealing with anaphylaxis.
You can be trained to put it in a good way regardless of profession. It's knowing how to deal with it if it needs taken out.